Hi, I wanted to follow up, as I said I was going to, about a little bit about prednisone and what I'm going to refer to actually, because I took the oral prednisone for my most recent relapse. I have had IV Solumebrol in the past. There have been a couple of studies to say or to find out if one is better than the other, the oral prednisone or the IVSM. And one is out of London. And I'll just, I'm not going to read the whole thing because it's way too boring, but they compared, well, they wanted to look at the bioavailability of IV methylprednisolone and oral prednisone in multiple sclerosis. So they compared the total amount of steroid absorbed after 1,250 milligrams oral prednisone, which is what I was taking. That's 25 pills a day for 5 days, as compared to the 1 gram of IVMP in 16 patients with multiple sclerosis. So they found that at 24 hours, the mean area under the concentration time curve, blah, 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 the availability was the same, both for the oral prednisone and the IV Solumebrol. So that leads me to another study that was done in the University of Calgary. That other study I was referring to came out of London Health Sciences Centre, their research centre. This one is from the University of Calgary, and they did a study on the same thing, that is one better than the other. And their main results or conclusions, after they analyzed 5 different trials of prednisone versus IV Solumebrol, and their summary was, the conclusion was that they do not demonstrate any significant differences in clinical benefits and adverse events, radiological or pharmacological outcomes. Based on this evidence, oral steroid therapy may be a practical and effective alternative to intravenous steroid therapy in the treatment of MS relapses. And the oral steroid therapy, which is what I was most recently on, is a lot cheaper than the IV Solumebrol. So that's good information to know, that these studies were done and they found that there really is no difference in the outcome and the side effects. And so it is a reasonable and valid option to take oral prednisone instead of going for the IV Solumebrol. And all the risks, benefits, and side effects are quite similar. So that's a little bit of information. Okay. I've heard it said that the steroid crash is like entering or re-entering Earth's orbit with only a heat shield, and I can't think of a better description. So, withdrawal symptoms from steroid use, whether it's long-term or whether it's high dose for a few days, which is what I would have done. 1,250 milligrams daily for 5 days, which I've probably already said. Anyway, so the problem, this is very small print, so please bear with me. I'm reading this from MedicineNet, and it's a pretty good description of what the withdrawal symptoms can be, some of which I did have. Now, they do talk about, they say that steroid use cannot be stopped abruptly. However, this is the way I did it, and this is the way I was told to do it. So, the steroid withdrawal can involve the adrenal glands, the pituitary gland, and brain, the hypothalamic pituitary adrenal axis. So yes, if you stop using the steroids, you can directly affect the HPAA, which I just said, but that's the acronym function. So some of the side effects of withdrawal being nausea, I didn't have that. Weight loss, which I did actually, which was kind of good because I was a bit swollen. I was quite swollen from the use of the steroids. Vomiting, which I did not have. Diarrhea, which I did have for a few days. And abdominal pain, which I did not have. So that's part of the steroid crash. And from what I'm reading, the crash is going to happen whether you stop abruptly or you taper down. So the way they work it now is that you have it for 5 days, just the same as Solumebrol, and then you stop abruptly, and your body has to completely re-regulate itself because of the withdrawal of the drug. So that is all about prednisone and the steroid treatment of MS relapse. And I'm not a doctor. I mean, I am not a doctor. I am reading this because these are documented facts. So I'm just letting you know how it affected me, how it helped me, which it really did, and how the side effects were pretty hard to take, but you know what? In the long run, it was the best thing for me. So that's it. That's all I'm going to say. That's all I can say about prednisone and IV Solumebrol and the side effects of getting off the drug. And yeah, so it's good. It's bad. You take the bad with the good because the good is really good, and you just carry on. So anyways, thank you so much for watching, and I will talk to you later. Okay, bye-bye now.